Hello and welcome to the BUE Shop Talk. Today I'm going to be talking about the risks associated with enema use, and before I get started, just a quick reminder that I am required by social media platforms to mention that I am not a physician and the contents in this video should not be taken as medical advice. I am a registered nurse and somewhat of an enema expert, and this is for educational purposes only. So a few videos back, I talked about the history of enemas and how enema use has been around for hundreds of years. Coffee enemas were actually included in the Merck Manual of Diagnoses and Therapies until 1973, so through the 11th edition. If you visit any alternative health sites online, you will find discussion boards full of people that have personally benefited from doing enemas. I'm one of them. Doing it either preventatively or for the treatment of certain conditions. Yet, in the mainstream medical community, there's this idea that this very ancient practice is responsible for all sorts of dangerous outcomes. So what were the events that caused this shift in a practice that was commonly recommended and used by doctors up until 1973? I mean, after all those years of success, did a wave of patients suddenly start reporting or presenting with negative outcomes? And did this lead to the ban, the anti-enema ban? Was there any research studies that were conducted that discredited the practice? Well, I did some digging and some research. I could not find a formal randomized controlled trial or case-controlled study done regarding enemas, but I did find a handful of case studies reported in different journals that did outline some negative patient outcomes. Keep in mind that case studies illustrate individual outcomes, not the prevalence of those outcomes among all patients routinely using enemas. Of all the fatal cases, I think there were 4 or 5, the cause of death was determined to be electrolyte imbalance. 2 of the case studies involved elderly patients that were actually admitted to the hospital, and both experienced cardiac arrest after being administered a very common over-the-counter pre-filled enema solution that contains sodium phosphate. Both of the patients, and this is important, both patients were given more than the recommended 1 dose within a 24-hour period. I believe one was given 4 in 24 hours, and then the other one was given 2, but it was close. It was like 30 minutes apart. Both patients experienced high phosphate levels and other electrolyte imbalances after receiving the enemas. One of the patients had a lot of chronic risk factors. The other one was fairly healthy, but both presented with abdominal pain and chronic constipation. So in other words, they presented for care for very serious GI health concerns. Some of the other cases involved the use of coffee enemas, in which 2 patients did die. And again, diving a little bit deeper into those case studies, one of the patients had severe abdominal pain, which she refused to seek medical attention for, and instead administered coffee enemas hourly while at home. And until she was too sick, she ended up being taken in and had a grand mal seizure. The second patient had end-stage cancer with metastatic disease throughout her whole body. She was doing a few coffee enemas too and did present with electrolyte imbalances, but she had admitted to feeling very weak before she had started the coffee enemas. She was feeling weak. She had been vomiting, which can also cause imbalance in electrolytes. Some of the other non-fatal cases included patients with rectal burns and mucosal damage after doing coffee enemas. That is totally preventable. None of the cases, just to note, none of the cases involved a relatively healthy person doing enema cleansings as part of their wellness practice. So, is there justification for the stigma against enema cleansings? Everything has a potential risk factor if guidelines aren't followed, and it's very obvious in all those case studies that proper guidelines were not followed. It is estimated that up to 50% of people are chronically constipated, and I know this to be true because I've taken care of a lot of patients over the years, and most of them have a diagnosis of constipation, and they have laxatives and stool softeners in their medication list. You might just ask yourself these questions. Is it fair to label certain health practices as quackery due to a few negative outcomes when there's such a long history of safe, patient, positive experiences? If constipation is a significant health complaint and it generates billions of dollars in pharmaceutical sales, could there be an incentive to discourage a simple, inexpensive practice such as enema cleansing? What kind of warnings and side effects are associated with the use of laxatives and stool softeners? That's some questions for you to ponder. Thank you for being here. You've made my day by watching this. If you made it to the end of the video, huge thanks. Hit the follow button only if you're dying to know more about enemas. My BUE bottle, it's reusable and it's available for purchase on the TikTok shop, the Amazon, and the Walmart platforms. In wellness.